Today's topic is types of joints. There are three main types of joints: fibrous immovable, cartilages partially movable, and the synovial freely movable joint. Fibrous joint. Fibrous joints are connected by dense connective tissue consisting mainly of collagen. Fibrous joints can be further subclassified into 1. Sutures, 2. Gumbasis, 3. Syndesmosis. Suture found only in the skull. Joints are together with very short interconnecting fibrous bone edges interlock. There is limited movement until about 20 years of age, after which they became fixed and immovable. Gumbasis, they are found where the teeth articulate with their sockets in the upper teeth or the lower teeth. The tooth is bound into its socket by the strong periodontal ligament. Syndesmosis. Joints held together by a ligament. Fibrous tissue can vary in length but is longer than in sutures. Cartilages joint. Cartilages joints are a type of joint where the bones are entirely joined by cartilage, either hyaline cartilage or fibrocartilage. There are two main types: synchondrosis and symphysis. Synchondrosis. Primary cartilageous joints mainly found in the developing skeleton. Immovable joint. Bones are connected by hyaline cartilage. Example: epiphyseal plate, first sternocostal plate. Symphysis. Symphyseal joints are where the bones are connected by a layer of fibrocartilage, slightly movable. For example, pubic symphysis and the joints between vertebral bodies. Synovial joint. The presence of a fluid-filled joint cavity contained within a fibrous capsule. It's a freely movable joint, and the synovial joints are subclassified into hinge, saddle, plane, pivot, condyloid, ball and socket. Hinge permit movement in one direction like the hinge on a door. For example, ankles, elbows, fingers, knees and toes. Saddle. Synovial joint in which the opposing surfaces are reciprocally concave and convex. For example, carpo-metacarpal joints. Plane. The articular surfaces are relatively flat, allowing the bones to glide over one another. For example, acromioclavicular joint and subtalar joint. Pivot. That allows only rotatory movement around a single axis. For example, proximal and distal radioulnar joints. Atlantoaxial joint. Condyloid contains a convex surface which articulates with a concave elliptical cavity. For example, wrist joint, metacarpophalangeal joint, metatarsophalangeal joint. Ball and socket. The ball-shaped surface of one rounded bone fits into the cap-like depression of another bone. For example, hip joint and shoulder joint. Hey guys, thank you for watching.